Ever wondered what hypertension is and how it affects your health? Well, let's unravel this mystery together. Hypertension, commonly known as high blood pressure, is a prevalent health condition that silently slips into our lives. It's a situation where the long-term force of the blood against your artery walls is high enough to eventually cause health problems, such as heart disease. Now imagine this. Your arteries are like a garden hose. When the water pressure is too high, the hose may burst. Similarly, when the pressure in your arteries is too high, it can cause damage, leading to serious health complications. It's essential to understand that hypertension is often a silent condition. Many people won't experience any symptoms. It may take years or even decades for the condition to reach levels severe enough that symptoms become apparent. Unfortunately, these noticeable symptoms can be a sign of severe medical conditions. There are two types of hypertension you should be aware of. The first is primary or essential hypertension. This type is the most common, and it tends to develop gradually over many years. The exact causes are often unclear, but it's believed to be a combination of genetics and environmental factors like diet and lifestyle. The second type is secondary hypertension. This type tends to appear suddenly and cause higher blood pressure than primary hypertension. It's often the result of an underlying condition like kidney disease or hormonal disorders, or even due to certain medications. Whether it's primary or secondary, the fact remains that hypertension is a silent killer that can lead to severe health problems if left unchecked, so it's crucial to understand and manage this condition. Now that you know what hypertension is, let's delve into the causes. So what causes this silent threat called hypertension? You might be wondering. Well, there's no one-size-fits-all answer. It's a complex issue with numerous contributing factors. Firstly, lifestyle choices play a significant role. Smoking, for instance, can damage your blood vessels, making them narrower and causing your heart to work harder. Over time, this can lead to higher blood pressure. Being overweight is another lifestyle factor that can contribute to hypertension. The more you weigh, the more blood your body needs to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. A lack of physical activity can also lead to weight gain and increased heart rate, both of which can raise your blood pressure. Dietary choices, too, can impact your blood pressure. Consuming too much salt, for example, can cause your body to retain fluid, resulting in higher blood pressure. Similarly, excessive alcohol consumption can gradually increase your blood pressure and also potentially damage your heart. Stress is another contributing factor. While the link between chronic stress and blood pressure isn't well understood, it's known that stress may lead to other risk factors such as poor diet and excessive alcohol consumption. As we age, hypertension becomes more common. This is because our blood vessels gradually lose some of their elastic quality, which can contribute to increased blood pressure. Genetics also play a part. If your parents or other close blood relatives have high blood pressure, you're more likely to develop it too. Lastly, certain chronic conditions such as kidney disease and diabetes can increase your risk of hypertension. It's important to note that while these factors can increase your risk, they don't guarantee you'll develop high blood pressure. It's a complex condition with many contributing factors, and everyone is different. Knowing the causes, let's talk about how you can recognize if you have hypertension. How do you know if you have hypertension? Let's find out. Hypertension, often referred to as the silent killer, can go unnoticed for years as it typically presents no symptoms. This makes it all the more crucial to have regular checkups and monitor your blood pressure. Even though no outward signs may be present, the damage to your body's internal systems can silently accumulate over time, leading to serious health repercussions. When it comes to blood pressure, there are two key numbers you need to be aware of: systolic and diastolic. The systolic pressure, the higher number, indicates the pressure in your arteries when your heart beats. The diastolic pressure, the lower number, signifies the pressure in your arteries between heartbeats when your heart is at rest. So what is considered a normal blood pressure range? A healthy blood pressure reading is typically around 120 over 80 millimeters of mercury. But here's the catch. If your blood pressure consistently reads at 130 over 80 or higher, you fall into the hypertension category. Sometimes, hypertension can present symptoms when blood pressure reaches extremely high levels, or if it has been high for a long period. These symptoms can include headaches, shortness of breath, nosebleeds, flushing, dizziness, chest pain, visual changes, or blood in the urine. However, these symptoms are not specific to hypertension and can be caused by other conditions. Therefore, they should not be used as a reliable indicator of whether or not you have high blood pressure. The only definitive way to know if you have hypertension is to have your blood pressure checked regularly. The American Heart Association recommends that adults aged 20 and older have their blood pressure checked at least once every 2 years. If your blood pressure is high, your healthcare provider will likely recommend more frequent checks. If you find your blood pressure is consistently high, it's time to talk about what you can do to reduce it. So, you've got high blood pressure. What can you do to bring it down? Well, the good news is there are several lifestyle changes you can make to help reduce hypertension. First off, let's talk about your diet. A healthy diet can go a long way in controlling high blood pressure. Try to incorporate more fruits, vegetables, whole grains, and lean proteins into your meals. These foods are rich in essential nutrients that help regulate blood pressure. Another significant change you can make is to minimize your sodium intake. Excess sodium can cause your body to retain water, putting extra burden on your heart and increasing your blood pressure. So try to limit the amount of salt you use while cooking and avoid processed foods, which are often high in sodium. Regular physical activity is also key in reducing hypertension. It doesn't have to be anything intense. Even brisk walking for 30 minutes a day can make a difference. Regular exercise helps strengthen your heart, allowing it to pump more blood with less effort and decreasing the force on your arteries. Limiting alcohol intake can also contribute to lower blood pressure. While moderate drinking can potentially have some health benefits, too much alcohol can raise your blood pressure, among other health problems. So, try to stick to moderate levels, which is generally up to 1 drink a day for women and up to 2 drinks a day for men. And lastly, if you're a smoker, quitting can greatly improve your heart health. Each puff of cigarette smoke causes a temporary increase in blood pressure, and the chemicals in tobacco can damage your blood vessels, leading to hypertension over time. Remember, these changes aren't just about reducing your blood pressure, they're about improving your overall health and quality of life. And while these lifestyle adjustments can significantly help, they may not always be enough on their own, especially for people with very high blood pressure or other health conditions. While lifestyle changes are important, sometimes they are not enough. Let's talk about diagnosis and treatment. When lifestyle changes aren't enough, how is hypertension diagnosed and treated? That's a question many of us have asked. Well, let's dive right in. To diagnose hypertension, doctors rely on regular blood pressure readings. This is typically done using a device called a sphygmomanometer. A cuff is wrapped around your arm and inflated, restricting blood flow. As the cuff deflates, it measures the pressure in your arteries. If the pressure remains consistently high across multiple readings, you may be diagnosed with hypertension. But let's not forget, one high reading doesn't necessarily mean you have hypertension. It's normal for blood pressure to rise and fall throughout the day. However, if it remains high over time, that's when we start to worry. Therefore, it's vital to have regular checkups to monitor your blood pressure levels. Now let's talk treatment. If diagnosed with hypertension, your doctor may prescribe medication to help lower your blood pressure. There are several types of drugs available, including diuretics, beta blockers, and ACE inhibitors, each working in a unique way to reduce your blood pressure. Your doctor will decide which one is best for you based on your individual health profile. Alongside medication, you'll likely be advised to continue with the lifestyle changes we've previously discussed: eating a healthy diet, exercising regularly, limiting alcohol, and avoiding stress, to name a few. Remember, treating hypertension isn't a one-and-done deal, it's a lifelong commitment. Regular doctor visits are crucial to monitor your progress and adjust your treatment plan if necessary. Regular monitoring can help prevent complications like heart disease and stroke. And I can't stress this enough. Don't stop taking your prescribed medication unless your doctor tells you to. Stopping suddenly can lead to a dangerous spike in blood pressure, which can be life-threatening. So there you have it. Hypertension can be a silent killer, but with knowledge and action, it can be managed effectively. Let's make a pledge to keep our hearts happy and healthy, shall we?